We are so delighted to welcome Dr. Reiko Asano.
Hi everyone, my name is Reiko Asano.
Thank you, Dr. Reiko. Then could you please introduce yourself?
Sure, I'm a nurse and I have a PhD, and I'm currently a postdoctoral fellow at Georgetown University.
Thank you so much for your introduction. I'm curious to know, why did you become a nurse?
Yeah, so I initially had a very different career. So I actually studied law at the Jesuit founded Sophia University or Jochi University in Tokyo. And while I was a student at Sophia, I learned a great deal about the Jesuit philosophy, which includes living and working as men and women for others towards a greater universal global competency. And this philosophy has had a profound effect on me, the extent of which I didn't fully realize until well after I graduated from Sophia. So after I graduated from Sophia, I worked for a Japanese bank's international investments division at their headquarters in Tokyo. And while I really enjoyed my job in the sense that, every day was so different, so fast paced, and I did really felt like I was in the center of global financial market, but I knew that there was something missing. And in short, I felt like I was not fulfilling the Sophia University's philosophy of living and working as men and women for others. So one day I was traveling. I was doing the international travel, and I was on a plane from Detroit, Michigan, back to Narita, Tokyo. And 2 hours after departing from Michigan, I witnessed a man in a row of seats nearby me fall into a severe diabetic coma, while any and all medical professionals among the passengers were asked to help him. And luckily, there was a healthcare provider on board who was able to give the man spontaneous treatment and save his life. And at that very moment, I felt not powerless, but very helpless. And I wanted to help this man, but I could not do anything. And nevertheless, at the same time, I realized that someone can actually save a life with just two hands. And this moment is when I started to think about going into a medical field and truly becoming a woman for others. And that's how I ended up going into nursing.
Wow, that's so powerful transition that, you made your life change. Thank you so much for sharing. Also, why did you pursue your career to get a PhD? I'm also curious to know about that.
Yes. So I was inspired to study cardiovascular disease after caring for sick patients suffering from high symptom burden and repeated hospitalizations in the cardiac ICU. And nurses are on the front line taking care of sick patients and spending the most time with them when they are in their most vulnerable state. And I believe that advancing nursing research will have a meaningful impact on how we care for individuals with cardiovascular disease. So that's how I decided to study for a PhD.
And then could you tell us your expertise or research area and focus?
Sure. My research area is cardiovascular disease. So, specifically, right now, I'm focusing on heart failure and palliative care. So, my research involves improving symptom management, advancing our understanding of heart failure and palliative care. So, right now, specifically, I'm looking at patients with heart failure and having severe breathlessness or dyspnea, because that's the number one cause of emergency visits and hospital readmissions. So I'm looking at different ways to decrease breathlessness to prevent patients from coming back to the hospital and to help them have a better quality of life.
Thank you. I've heard so many patients are not able to take surgeries because of this current pandemic. From your perspective, what are the experiences of nurses during this really challenging time?
Yes, of course, many nurses are on the front line and have had to deal with adjustments in infection control procedures, as well as dealing with overwhelming numbers of critically ill COVID positive patients. And for myself as a research nurse, the changes were more operational, such as teleconferencing versus in person, and other forms of remote interaction in addition to normal scholarly activities of research. And funding priorities have also changed both in the clinical and research realms of nursing. And now there is an increased focus on logistics of care delivery and resource management, including, of course, infection control.
Thank you so much for providing your perspective. Finally, could you give us a message to nursing students and nurses who will become the future leaders?
Sure. When I was still a nursing student, I shadowed a nurse in the shock trauma ICU and saw an accident victim arrived unconscious, and she was in early 20s. And I could see that the patient was fighting, battling, and trying to live with all her potential will. And the nurses were matching that fierce desire to survive and doing their utmost to help her try to live. And the patient survived. And afterwards, I reflected on that power of those moments and how they gave me an unparalleled combination of adrenaline rush and gratitude. And that experience still has profound effect on me. And as you may know that in the United States, nurses are ranked as the most trusted profession for the past 19 years in a row. And I think that nurses have a lot of pride in what they do, and they often stand up for vulnerable populations. And they also try to advocate and be the voice for those whose voices may not be heard otherwise. So I believe that choosing a career as a nurse will expand your options. And with a degree in nursing, you can be a school nurse, bedside nurse, public health nurse, a researcher like myself, consultant, professors, congressmen or congresswomen. And there are so many other career opportunities for nurses to explore because the nurses have a special skill set, knowledge, and perspective, and they can play a crucial role in any of the fields I just mentioned and above and beyond. So I'm very excited for the people who are entering the nursing profession right now and for those who are already in nursing profession and becoming the future leaders.